today is actually part of our crash course series. We're going to talk about epilepsy today. And I know when we think of epilepsy, a lot of us, at least me, kind of think of childhood epilepsy, right? Teens, adolescents, and children that are diagnosed with epilepsy, not so much of seniors or older adults. But I have learned through my research that epilepsy is actually diagnosed often after the age of 55. So you can develop epilepsy later on in life. And so I'm grateful for all of you that showed up today, because even though this may be a diagnosis that you're not currently dealing with, it may be something that you will have to face later on with your loved one or even with yourself. So I appreciate all of you coming to learn, even if it may not be personally applicable to you right now. I think that it's still good information to have. So thank you for joining us. So I'll go ahead and get started. I'll go ahead and start sharing my screen here so we can get the information underway. So I only have about 17 slides today. When typically a presentation will be about 20 or more. So if we end early, that's okay. As long as you guys get the information, right? And if I'm talking too fast, please let me know, because I do have a habit of doing that. So I apologize in advance. All right. Okay, so we're just going to talk about, before we begin, obviously I like to have this little disclaimer. I'm a researcher, I'm a social worker, not a licensed medical professional. And so any information you're going to get today is going to be for educational purposes only and should not be used to treat, diagnose any illness or act as a substitute for professional medical care and or therapeutic care. Okay, so while the information here is valid, I did get it from some credible sources. I don't want you to take what I say here and start diagnosing your friends and families with epilepsy. And of course, you always want to consult with your primary care doctor with any treatment options or any questions about a diagnosis you may have, okay? So today we're going to define seizures. What is a seizure? We're going to talk about the different types of seizures that people can experience. Then we're going to define epilepsy, because having a seizure does not mean that you have epilepsy. Okay, so we're going to talk about what epilepsy diagnosis is. We're going to talk about causes and treatments of epilepsy, because there are several. And then we're going to go over some first aid myths and protocol, because first aid, that's where we're going to spend the majority of our time today, is in first aid protocol and dispelling myths, because I think when people think of seizure disorder or epilepsy, they can kind of get a little scared, they don't know what to expect. They don't know how to handle that situation. And so I think it's important for us to go through just, your safety protocol when it comes to a seizure episode, okay? So what are seizures? Seizures involve sudden, temporary bursts of electrical activity in the brain that change or disrupt the way messages are sent between brain cells. These electrical bursts can cause involuntary changes in body movement or function, sensation, behavior, or awareness. Every brain has the potential to seize, okay? You don't have to have epilepsy to have a seizure of the brain, okay? But a person with epilepsy has a lower seizure threshold, and that just means that they're more likely to have seizures than people without epilepsy. But again, everyone has the capacity to. Hold on.
Tater tots for the win.
Oh, did I skip ahead? I think I accidentally skipped ahead. Hold on one second. I was trying to deal with the sound there, and I got ahead of myself. Okay, so it's important to note that the distinction between seizures and epilepsy. A seizure is an event and can be a symptom of other medical problems, okay? So you can have seizures and not have epilepsy. It can be caused by another medical issue. Some seizures can be hardly noticed, while others are totally disabling. About half the people who have one seizure without a clear cause will have another one, okay? And if there is a known cause for your seizure, you are twice as likely to have another, okay? And seizures are not contagious. Oh, and now my screen's all wonky again. There we go. Okay, so there's many different types of seizures and different types of epileptic seizures. So the type of epileptic seizure that, well, we're going to talk about children, but it can apply to everybody. But the type of epileptic seizure child has depends on which area of the brain is affected. So there's two main types of seizures. There's a focal seizure and a generalized seizure. Focal seizures start in only one side of the brain, and a generalized seizure will affect both sides of the brain. Generally, adults and children have the same types of seizures. However, some may be more common in childhood. For an example, an absent seizure can be very brief and it's often mistaken for daydreaming or not paying attention. So different, oh, hold on, we got another person trying to come in here. All right. So the generalized onset is also known as the tonic-clonic or the grand mal seizure. And the symptoms of that is convulsions, rigid muscles, jerking, typically lasting 1 to 3 minutes and followed by a period of confusion. Generalized onset of absence or petit mal seizures can look like a blank stare lasting only a few seconds and sometimes with blinking or chewing motions. So again, if you just see somebody like a child like staring off into space, you might think, well, they're just daydreaming or not paying attention, but it could be an absence or petit seizure if they have a seizure disorder. There's focal onset of impaired awareness. It's also called a complex partial seizure. And this can be staring and dazed facial expression. The person is not aware of what's going on, or they'll not remember afterwards. A person may perform repetitive random movements, and they may not be able to talk normally. And so typically this will last 1 or 2 minutes and may be followed by confusion. Most of these seizures are going to be just a few minutes long. They're not going to last very long. Then there's the focal onset aware, also known as the simple partial. And this can be jerking in one or more parts of the body or sensory or peripheral changes that may or may not be obvious to onlookers. The person is aware of what occurs during the seizure. So you can see how there's impaired awareness where they're not sure what's happening during the seizure. They don't really have a lot of memory. And then there is an aware seizure where they know exactly what's going on and they remember it after the seizure has ended. Then there are atonic seizures, also known as drop attacks. So this would be a sudden collapse with recovery within a minute. So they just fall and then they get up, okay? So just within 1 minute. Myoclonic, and if I pronounce these words improperly, I apologize in advance. But so a myoclonic seizure is a sudden, brief, massive jerks involving all or parts of the body. So this would probably be the one that you would see like on TV or in movies when someone says, oh, they had a seizure and their whole body is violently shaking. That would be a myoclonic seizure. Then there's a tonic seizure, which is sudden stiff or tense body, arms or legs. A person might fall and it lasts around 20 seconds. And then there is an epileptic spasm, also known as infantile spasm. And this is a brief 1 to 3 second event of arms and legs and head pulling into or extending from the body. So either going out or coming in, okay? Often this will happen in clusters every 5 to 10 seconds over a 5 to 10 minute period, okay? So knowing the types of seizure your loved one has can help you to prepare for when they do have a seizure episode, okay? So all of these seizures are different, but most of them include the jerking of the body, repetitive movements, unusual sensations such as a strange taste in the mouth or a strange smell or a rising feeling in the stomach. In some types of seizures, they may be aware of what's happening. In other types, they will be unconscious and have no memory of the seizure afterwards. And some children may have seizures while they're sleeping, sometimes called nocturnal seizures or sleep seizures. And seizures during sleep, they can affect sleep patterns, obviously. And it might leave your child feeling tired and confused the next day. So if you have a child who has a seizure disorder or epilepsy, and they're waking up feeling tired and confused, maybe they had an overnight seizure, maybe they had a nocturnal seizure, okay? There we go. So now we're going to define epilepsy. And I don't know why my screen is so goofy, but okay. So epilepsy is a neurological disease. Okay, so that's a disease that affects the brain. A person with epilepsy is at a higher risk for having reoccurrent or more seizures than the rest of us. And sometimes people use the word seizure disorder to describe epilepsy. Again, remember I said in the beginning, we all have the capacity to have seizures. But if you have a seizure disorder or if you have epilepsy, you're more prone to it. Okay, you have a lower threshold for that. So a diagnosis of epilepsy does not define the cause or the outlook. So what that means is you can have epilepsy, but there's no one size fits all, right? It's a spectrum disorder, meaning that it's not a binary black and white, this or that, okay? It's this, that, and everything in between, okay? So there's many different types of seizures and types of epilepsy syndromes. The impact of epilepsy on a person will vary, and this will depend on the type, frequency, and severity of the seizures that they're having, the type or the area of the brain that's affected, the cause of the epilepsy, which we'll go over in a little while, and how a person responds to treatment, and lastly, underlying brain abnormalities that are present. So there's a lot that goes into diagnosing epilepsy besides just the seizure, okay? Just having a seizure, we have to know what kind of seizure it was, how is it responding to medication, or any other things going on that maybe are causing the seizures, okay? So there's a lot that goes into it. You can't just assume because somebody has a seizure that they have epilepsy, okay? So now we're going to talk about causes of epilepsy. So we've got a couple here. Head injury, previous falls, concussions, or any injury to your head could cause epilepsy. Epilepsy isn't necessarily always something that you're born with. It can be something that develops after an event, okay? Taking precautions during activities like bicycling or skiing or riding a motorcycle obviously will help protect your head against injury and possibly prevent future epilepsy diagnoses, okay? So that's why, I know most of you probably are from my generation or earlier, but bicycle helmets just weren't a thing. We didn't do that. We'd get bumps and bruises all the time, but now people are more aware of the potential dangers of head injuries in children, and so we see more of those protective headgears than we did back in my day. Brain infections may cause epilepsy, so think of things like meningitis. That'll inflame the brain and the spinal cord and can increase your risk for developing epilepsy. Stroke or vascular disease, okay? Blood vessel diseases and strokes can cause brain damage. And damage to any area of the brain may trigger seizures and eventually epilepsy. Again, you can have a seizure and not have epilepsy, but if you're having seizures due to stroke or vascular diseases, it can develop into the epilepsy diagnosis. So the best way to prevent epilepsy caused by vascular disease is to take care of your heart, right? And your blood vessels, eat healthy diet, exercise, avoid tobacco and over alcohol consumption, okay? This also will help prevent against vascular dementia as well, okay? Brain tumors can cause epilepsy. Again, anytime that you're seeing damage to the structure of the brain, you have that risk of developing a seizure disorder or epilepsy. Next, Alzheimer's disease or dementia. People experiencing a decline in mental function may also develop epilepsy, and this is most common in older adults. Malformation of an area in the brain. So in utero, while a baby is developing, there could be a malformation in the brain that causes the child to be more prone to seizures. And so that's also a factor genetically, and then next one is genetic. So if a close family member has epilepsy, you're more likely to develop the disorder, okay? Children with parents who have epilepsy have a 5% risk of developing the disease themselves. So it's not a guaranteed hereditary thing. If you have epilepsy, your children are gonna have it, but it definitely is a risk factor, okay? It's something that your doctor will consider when they diagnose. So some children develop epilepsy as a result of their brain being injured in some way, a severe head injury, difficulties at birth, or an infection. And this kind of structural change is sometimes called symptomatic epilepsy, okay? So that means that there is a distinct cause. There's epilepsy is the result, it's a symptom as the result of something else that has happened. Some researchers now believe that the chance of developing epilepsy is probably always genetic to some extent, and that anyone who starts having seizures has always had some level of a genetic tendency to do so. This level can range from high to low and anywhere in between. So even if seizures start after a brain injury or other structural change, this may be due to both the structural change and the person's genetic tendency to have seizures combined. So this makes sense if you consider that many people might have a similar brain injury, but not all of them will develop epilepsy afterwards. Epilepsy can begin at any age, but more people are diagnosed into two distinct phases of life, either early childhood or after the age of 55. Next, who has epilepsy? How prevalent is it? Well, in the United States, 3.5 million people live with epilepsy, and over 150,000 new cases are diagnosed each year. That's 1 in 26 people who will develop epilepsy at some point in their life, so it's fairly common. Epilepsy does not discriminate, like many disorders and diseases and diagnoses. It can affect children, adults, all genders, all people of all races, religions, ethnic backgrounds, and social classes. While epilepsy is most often diagnosed either in childhood or after the age of 65, it can occur at any age. And I think this is important to know that it says, you know, all genders, all people of all races, religions, ethnic backgrounds, and social classes. I know for a fact that there are people who believe that epilepsy is caused by has a spiritual component to it, a demonic influence to it, and the science just says otherwise, okay? Anybody of any religion, of any faith, of any background can develop epilepsy, no demon required. How is epilepsy diagnosed? Well, this is when it's going to be really important for the caregiver to be aware when a seizure takes place. Take notes, okay? Bring all the information you can to your provider when you're looking for a diagnosis. So that would be a good description of the event. Ideally, an eyewitness account or video recording is key to determine if the event was a seizure and what kind. Again, we went through kind of some of those symptoms. So if your general practitioner or your doctor is looking at a video, they can see by the way that the person is moving during your seizure, how long it lasts. Maybe they can determine what type of seizure it is. Having a medical history, physical and neurological exam, blood work, and other tests are important because they can help diagnose epilepsy and look for other conditions or causes. Again, you can have a seizure and not have epilepsy, so they kind of have to rule out everything else before they give you that diagnosis. An EEG is one of the most important tests. Okay, so this will record a brain's electrical activity. Some patterns of activity are unique to certain types of seizures. So that's when they hook your brain up with all those fun little wires and they just kind of evaluate the electrical patterns in the brain during a seizure. And then finally, imaging tests like a CT or an MRI can be done to look at the brain structure, while others, like a PET scan, may be done to measure function of the brain if seizures fail to respond to initial treatments, okay? So it's diagnosed basically through a lot of, what's we're looking for? Descriptions of the situation, letting the people know how long they lasted, seeing the kind of physical response that the person's having during a seizure. So a lot of it is just about observing. That's the word I was looking for. Observing the client to see, or the patient to see what type of seizure they're experiencing. So how do we treat epilepsy? There's a couple different options, but the most common option is through medication. So drugs that are used to treat epilepsy are called anti-seizure medications. More than 30 anti-seizure medications are currently approved to treat epilepsy, so there's many options. About 6 in 10 people may control their seizures with the first or second medicine they try, which is great, especially when you consider some of these other disorders or some of these other diagnoses people have, and it seems like trying to find the right fit takes forever. So if you have epilepsy, you're fortunate in the regard of being able to find treatment fairly quickly. Regardless of the numbers, if a person does not get control of seizures in the first year or after the first 2 or 3 medications they've tried, then they should be seen by an epilepsy specialist, okay, to try and figure out why aren't these medications working. Options beyond medication might be possible, and that can include surgery. So there's certain types of surgeries that can be used for people whose seizures don't respond to medication, okay? Surgery may be recommended when a seizure focus can be found and removed without hurting vital functions like speech or movement. So if that's what they're saying, if there's something in the brain, like possibly a tumor, that's causing it, then if they can remove it safely without causing any other impairments to the person, then they'll probably opt for that if medication doesn't work. Next, we have devices. So there's actually devices that you can use for people who have seizures that are difficult to control. So a small device is implanted, which delivers an electrical signal to change what a nerve or the brain does. So there's different types of devices and each of them work differently. So of course, if you're talking with an epilepsy specialist, they can go over all the details with you on that. Next, we have dietary therapies. If you're part of our nutrition and mental health class, here's another thing that nutrition can affect, right? Dietary therapies can help control seizures in both children and adults when medicines alone don't work, okay? So there's four major dietary therapies that are used to treat epilepsy. There's the ketogenic diet, or keto, medium chain triglyceride diet, or MCT, a modified Atkins diet, or MAD, low glycemic index treatment, LGIT. And really what this means is all of these diets are going to be low in carbohydrates like sugar, pasta, and bread, and high in fat like butter, oils, bacon, and avocado, okay? So those are brain healthy diets. So we're going to start talking about some first aid protocol now. So an epilepsy diagnosis in the family can be overwhelming at first. Some people with epilepsy don't need much help, if any, while others might need round-the-clock care. Again, we're talking about a spectrum disorder, so not everybody's going to have every symptom of this of the diagnoses. If you're providing care for a loved one with epilepsy and don't know where to begin, I'm going to give you 7 tips to help you get started. So first one is to learn first aid protocol. I think that's probably the most important thing you can do, because if something happens and you are not prepared, it's going to be a lot more anxiety inducing for you, a lot more fearful, and you might end up not doing anything, which could potentially cause more damage. So learning first aid protocol, understanding what to do when a seizure occurs is crucial for ensuring the person that you're caring for and possibly others doesn't hurt themselves. Seizure first aid is simple, and in most cases, an ambulance does not need to be called, okay? So just because someone has a seizure, it does not mean that you need to immediately call 911. So when someone has a seizure, the first thing you do is you time the seizure. How long is the seizure lasting? That'll determine whether or not you need to call an ambulance. Cushion their head, right? We want to protect their head. Head injuries are common during seizures, especially when there are hard floors or objects that can cause harm. Again, you have to imagine this person is having an involuntary body movements, spasms, okay? They can fall over. And so we always want to make sure that we protect their head as much as possible. Roll them into recovery position. What that means is that you're going to prevent choking by rolling them onto their side. And if they have something in their mouth or after they stop moving, if they have something in their mouth or after they stop moving. So if they're seizing, you want to roll them to, or after they've done, after they've completed, you want to roll them over. And if they have something in their mouth, you'd want to roll them over to the side too, because you don't want them to accidentally choke. Stay with them until the seizure stops. So they may be confused or disoriented afterwards. Remember, sometimes they don't remember everything that happens. So help them remain calm and safe, especially if they're children. They might not understand what's going on. Now, there are signs that indicate that 911 does need to be called during a seizure. And that would be if the seizure lasts more than 5 minutes consistently. We're not talking about those infant spasms that happen, every 5 to 10 seconds for 5 to 10 minutes. We're talking about one continuous seizure that lasts longer than 5 minutes, okay? That's when you call 911. If the person is having difficulty breathing, okay? Anytime anybody seems like they're choking or suffocating, you always want to call 911. A seizure that might take place in water. This is important because even if somebody isn't actively drowning during a seizure, there may be moments during the seizure that they may have dipped under the water and swallowed some water or inhaled some water in their lungs. And so that would be a good reason to call 911 just to make sure they're okay. And then finally, any injury during a seizure, like trauma to the head, right? If they have a drop seizure and nobody can catch them or protect their fall, there could definitely be trauma to the head, okay, if they land hard. So those are the times that you would call 911. Now, before I continue on to the next step, I do want to address some first aid myths, especially when you think about how epilepsy has been portrayed in the media. There's a lot of common myths that are circulating that are just untrue. So we're going to address those right now. Common myth number 1, people can swallow their tongue during a seizure. So it is physically impossible for someone to swallow their own tongue, whether or not they're having a seizure. I remember being younger and hearing this, that if somebody has a seizure, they're going to swallow their tongue and they can choke to death. They may choke, but it's not going to be on their tongue, okay? Common myth number 2, when someone's having a seizure, put something in their mouth. How many of y'all have heard this? Try to, make sure they don't bite their tongue or what have you. But we should never force an object into someone's mouth during a seizure. Doing so could cause injury to the person. They could swallow the object, or they could bite your hand in the process, okay? So we don't want to force anything in anybody's mouth during a seizure. And then common myth number 3, you should restrain someone who's having a seizure. You should never restrain someone who's having a seizure. However, you should take precautions to make sure that they're in a safe place, such as moving furniture out of the way, moving sharp objects, and placing something soft under their head, okay? So injuries can occur during a seizure, but these myths typically do not apply in real life, okay? So the next step to help when someone has an epilepsy diagnosis, educate your family and your friends. Even though epilepsy is very common, it's often misunderstood. So the lack of awareness can make those who are uneducated about epilepsy anxious or even afraid. So especially if you're on our program and you have a loved one who has this diagnosis and you want to take a break, you want to have your respite, and then the person caring for your loved one might have some anxiety about what to do if a seizure happens, okay? That's why education is so important. So by teaching somebody basic first aid seizure first aid, you can help the family and close friends feel confident in the event of a seizure and better understand the condition. Being an advocate for the person you're caring for is one of the most helpful things you can do. Preach to the choir, right? This will help them and the people they're around feel more at ease and better prepared to handle the seizure, okay? Next, track seizures and the medications being used. Keeping a detailed record of both the seizures and medications for the person you're caring for is important in helping healthcare providers better manage their condition. So if you are curious if the medication's working well, or if maybe there need to be some other options explored, that's why keeping track is going to be very important. So next time you have a doctor's appointment, you can bring them that record and you can address any concerns there. The following information should be carefully documented. So what happened right before the seizure? That'll help the doctors and yourself determine what triggers there may be so that they can be managed in the future. The date and the time that the seizure took place, how long it lasted, the behavior of the person following the seizure. So how did they behave afterward? And all medications the person is on, the dosage of each, and the time of day each medication is taken. So ensuring that the exact dose of medication is taken on time is crucial in controlling seizures, and it gives the doctor of the person you're caring for an accurate picture of how well the medications are working and if any adjustments need to be made, okay? So of course you don't have to write, a 12-page paper, Times New Roman double spaced with citations or anything, but just, keep track of what's going on. And I think especially for caregivers where you are, running 24/7, it's easy to not be able to recall things in detail unless you write them down. And so I just encourage you, if you're caring for someone with epilepsy, a seizure takes place or anything like that, try to remember to write that down because you might not remember it when you're in front of the doctor, okay? So if you have it written down, then you don't have to think about it. Next, think safety. So seizures are often unpredictable. So preparing safe spaces in the home will reduce the likelihood of injury. So essentially, you're kind of baby-proofing your house. You can install padding on sharp corners. You can carpet floors or area rugs to soften the fall. Make sure that fireplaces have a fire screen because you don't want anyone accidentally falling into the fireplace. Use heaters that are designed to turn off if they're tipped over, especially if you're thinking of little ones. They might be experiencing a seizure, maybe fall over into the heater or grab it for balance. We definitely don't want that to be a hazard for them. Next, make sure all smoke alarms and carbon monoxide detectors are working. Ensure an up-to-date fire extinguisher is handy. Hide a spare key outside of the home in case you or someone else needs to get inside quickly, especially if you're caring for someone who maybe is older and maybe like a teenager is in the home by themselves, the door's locked, that way you can get in quickly. And when out and about, always be aware of the person's surroundings and take note of potentially hazardous situations. Again, seizures are unpredictable. So you can't say, well, we're only going to be at the store for 12 minutes and he's not going to hurt himself. Well, within that time frame, there could be a seizure and nobody would know it was coming. Okay. Number 5, develop a seizure management plan. I know for myself, the best way for me to combat anxiety is to be as prepared as possible. And so developing a seizure management plan not only alleviates anxiety for you, the caregiver, but of course, if somebody else is coming in to relieve you of your caregiving duties, it's good for them to have that as well so that they don't feel anxious and they don't feel scared and they know what they're supposed to be doing. So the following information should be included in your management plan. The type of seizures that they've been diagnosed with, all known seizure triggers, how to care for them during a seizure, and signs that the situation is an emergency and steps to take. Okay, so that would be if they have a seizure lasting longer than 5 minutes, you need to tell them to call the ambulance. Okay, if maybe they have seizures because of, flashing lights on the TV, then you want to make sure that they know that so that they can make sure that doesn't take place. Okay, and it's going to be customized to the individual because again, not everybody's going to have the exact same symptoms. So it's important to have all that handy. So ensure that anyone else involved in the plan is aware and knows what their role is. For instance, family members, friends, secondary caregivers, and healthcare providers, among others, might be part of the plan. Make sure that the person you're caring for always carries a copy of the plan with them just in case you're not there. So think about a management plan should be in their school or in their workplace, okay, so that people know what to do. And at least once a year, practice an emergency drill and the steps you'll take if there were an emergency, just like you'd practice fire drills with your kids, okay? Coordinate with the household to make it as close to reality as you can. Now, that being said, not every seizure requires 911 emergency care. But knowing what kind of care to provide your loved one will go a long way in easing your mind if you were to take a break and walk away from your loved one for a time, okay? Number 6, encourage participation. I think this is very important because just because you have an epilepsy diagnosis doesn't mean you have to stay locked in your home all day, right? That you can't participate in recreational activities. And we don't want to discourage that type of growth in our children, especially to make them feel like they can't be included with their peers. So having epilepsy doesn't always mean not being able to participate in many activities and sports. In fact, it is an important part of maintaining physical, mental, and emotional health. Recreational activity should always be cleared by your doctor, obviously. Anyone who's, because they'll be the most familiar with their medical record and seizure triggers. And depending on the severity of the seizures, there may be some activities such as contact sports like football that are off limits, or activities that a buddy will need to be present for, such as swimming. And so that would just mean somebody who's keeping an eye out. So they can tell if someone's about to have a seizure and they're in the water, they can swim to them quickly and keep them above water. And it's just kind of like, an extra safeguard there, okay? That doesn't mean they can't participate. And then finally, don't forget to take care of yourself, right? How many times have we said this, regardless of the topic? There's no doubt that you love the person you're taking care of, but you need to make sure you're taking care of yourself also. The constant worry and stress of unpredictable seizures can be exhausting, and that's perfectly normal, especially if your child is older and they're out living their lives and you can't be there all the time. Okay, that can be very, very stress-inducing. So we need to make sure that we have resources in place to help us manage that. So take time for yourself, ensure you're getting enough sleep, you're eating a healthy diet, and taking the needed time to relax and recharge regularly. And most importantly, ask for help when you need it. Okay. Are there any questions? That was kind of short and sweet, but hopefully you got some good information there. And I'll put my references up here just in case anybody is interested. Most of the information I got was through, epilepsy foundations, things like that. Most of them are pretty easy to search up. And if you're taking care of a loved one with epilepsy, you probably have already heard a lot of this information before, but it doesn't hurt to get a refresher, especially if you are looking for respite and you're looking for a respite provider to take over your caregiving duties. having this information to kind of give you a framework of how to direct that person should be helpful. And that's kind of the goal here. All right, I'll go ahead and stop sharing. And if anybody wants my slides for future reference, let me know and I'll email it to you. So do we have any questions about that, the training?
Good morning, everyone. This is Shirley. Did I hear you say that that was hereditary?
It can be. So if you are, there's a different, here, I'll go ahead and see if I can pull it up again, because I think you might have, hold on. Give me a second. It's back here with the causes, I think. Now I can't find it, hold on. There we go. So epilepsy could be something that develops later on in your life due to a head injury, brain infection, stroke, but then it can also be something you're born with as well. So it can be hereditary if you have an epilepsy diagnosis that was due to an in utero type of thing or a genetic factor. Then you're more likely to pass that on. Obviously, if you get epilepsy due to a brain infection or something like that, that's not going to be passed genetically down. But they are saying that it can be a combination of an outside symptom as well as a genetic factor. They're not sure 100%, but it can be.
Interesting.
Mm-hmm.
I had a brother, he passed from a massive heart attack, and he was having seizures. They never could figure out where they were coming from. So that's interesting.
Mm. Well, if he was having heart difficulties, that could be exactly where his seizures were coming from.
Yeah, he had a lot of health issues. So,
yeah. Yeah. So, and I always was under the assumption that epilepsy was something that you were born with. I did not know until doing the research for this training that there were several different factors that were genetic, environmental, and things like that. So I learned something too.
Wow. Wow.
And yeah, and I didn't know that epilepsy was something that could be developed either. Again, I just thought it was something you had or you didn't have.
I have a question. This is Charlotte.
Yes, ma'am.
Have you said anything about in our presentations that we've had about a brain fog? Because I'm wondering, how will you know if you're having a little seizure? How is that different from having a little brain fog?
Well, I think if it's accompanied with any type of involuntary movements, such as jerking of the limbs or chewing or anything like that, but if it's just kind of like, you know, a spaced out kind of brain fog feeling, I think the best way to determine if that's epilepsy would be to keep track of when it happens, how often it happens, what happened before, how you felt after, and bring that information to your doctor and say, I'm concerned that maybe I'm experiencing some sort of seizure, and I need to know if, you know, if you agree or if it's worth looking into a little further. Again, I just think that keeping track of your symptoms and the way you feel would probably be the best way to get a secure diagnosis.
Okay, thank you.
Mm-hmm. Anybody else? All right. So I will go ahead and let you know what we've got coming down the pipeline for us on the 30th of next week. We are going to continue our crash course series, and we're going to talk about autism spectrum disorder. This is a very common diagnosis in the United States, and it's very common among our caregivers on our program to be caring for someone with autism spectrum disorder. So I'm going to go over that. This presentation we had today was about 17 slides, and that one is about 34 slides. So it'll be a little bit longer. There's a lot of information there. And so if you join me for that one, I hope you find it helpful. And then, of course, we've got our support group coming up on the 2nd of February, which is sooner than we think. I'm still trying to figure out what we're going to do, because you know how I'm really terrible about games, but we did the traditional support group last month, so I want to switch it up this month. So if you have any suggestions, please let me know, because otherwise we might just be staring at each other, telling each other how cute we are, which I'm totally okay with that. Yes, I do hope though that this was informative and hopefully you learned something new or at least was reminded of something you already knew that can be applicable to your caregiving. But if anybody has anything that they would like to discuss or chat or talk about, we can do so. But if not, I won't take up any more of your time since this is the weekend and we're all probably hype and ready to get our rest on. Okay, Vanessa, I'll definitely send it to you. And also, if you don't want it sent to you, if you don't, think you need the slides, there's always going to be the recording later on today or early next week. But yes, I will send you that, and along with the references too, so that you can do your own research if you'd like. All right, well, if there's nothing else, I'll go ahead and let you all go. Again, thanks for showing up today. I appreciate it. And I will send you that post survey. Make sure you have your email in the chat so I can send it to you. And any feedback I get from you all is appreciated. So thank you for taking the time to complete that. You will have a great weekend. Yes, and I'll hopefully see you all next week with the support group, okay? All right, bye-bye.
Bye.